Welcome to TCM Board Formula Series. Today we review our Chen Tang 2 cured decoction. It belongs to the category dry dampness and transform phlegm. The fastest memory hook is this: the foundational Damp-Phlegm formula, transform phlegm, move qi, and restore the spleen's transport. By the end, you should recognize the core ingredients, formula hierarchy, pattern picture, major differentials, and modern safety checks. This lesson is for board preparation and professional education. It is not a diagnosis, prescription, or substitute for individualized medical care. Build the formula from its ingredients. Zhi Ban Xia dries dampness, transforms phlegm, and stops nausea. Chen Pai regulates qi and improves phlegm transformation. Fu Ling drains dampness and supports the spleen. Zhi Gan Cao harmonizes and protects the middle. Sheng Zhang assists phlegm transformation and harmonizes the stomach. Wu Mei restrains the dispersing action and protects normal qi. On an exam, do not memorize the list as isolated names. Link each ingredient to the treatment strategy. The composition should explain why the formula fits its pattern and why a similar formula does not. Now organize the hierarchy. The chief is Zhi Ban Xia. The deputy level is Chen Pai. The assistants are Fu Ling and Sheng Zhang. The envoy role is Zhi Gan Cao and Wu Mei. Together, the formula dries dampness and transforms phlegm, regulates qi, harmonizes the middle burner. A useful board habit is to ask what the chief attacks or tonifies, what the deputies reinforce, and how the assistants control side effects or protect the middle. The target pattern is damp phlegm from impaired spleen transport with associated qi stagnation. Look for this clinical picture: cough with copious white sputum, chest or epigastric oppression, nausea, vomiting, or reduced appetite, dizziness, heaviness, or palpitations from phlegm. The tongue is swollen with a thick, greasy white coat. The pulse is slippery. The board answer comes from the whole pattern, not one symptom. Match the disease mechanism, the treatment strategy, and the tongue and pulse before selecting the formula. Differentiate carefully. When Dan Tang a euro phlegm heat disturbs the Shen with irritability, insomnia, or timidity. Lu Jun Zi Tang a euro spleen qi deficiency is primary, with secondary phlegm. Ban Xia Ho Po Tang a euro qi phlegm constraint centers on the throat and emotional fluctuation. When two formulas seem close, identify the single feature that changes the treatment strategy. Ask whether the presentation is excess or deficiency, hot or cold, exterior or interior, and whether phlegm, dampness, food, blood, or sinking qi is the main driver. Safety is part of formula knowledge. Classical cautions include: use only properly processed Ban Xia in a verified product. Use caution in dry cough, yin deficiency, blood-streaked sputum, or marked fluid depletion. Chest pain, coughing blood, low oxygen, or severe breathing difficulty requires urgent evaluation. Modern medication review includes: Zhi Gan Cao requires review with diuretics, corticosteroids, digoxin, antihypertensives, and potassium-sensitive conditions. Changes in nausea, vomiting, or bowel transit can alter absorption of oral medicines. Use a verified product, document the complete medication and supplement list, set monitoring parameters, and refer when red flags exceed the scope of routine herbal care. Formula names do not guarantee identical composition or concentration across products. Finish with 5 board pearls. Number 1. Foundational Damp-Phlegm formula. Number 2. Ban Xia and Chen Pai. Number 3. Copious white sputum. Number 4. Greasy white coat. Number 5. Slippery pulse. The one-line recall is, the foundational Damp-Phlegm formula, transform phlegm, move qi, and restore the spleen's transport. Review the ingredient architecture, then practice distinguishing the nearest look-alike formula. This concludes our Chen Tang. Save this lesson for spaced repetition, and always connect board memorization with safe clinical judgment.